Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752.
And we will give out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, when you call in, and I'll pay the postage. How about that?
All right.
So we're talking about how to heal your musculoskeletal orthopedic pain without surgery. And I used to love being in the surgeries in my training. I did a lot of orthopedic surgery until I had my own shoulder surgery failure. And in a way, I'm glad I had that failure because it prompted me to learn how to heal the body with simple injections of platelets and stem cells. The old days, we called it prolotherapy or proliferative therapy, and the name regenerative medicine is one of the newer names to it. Lots of research being done on that. Orthopedic surgeons say this stuff can't work, but I've done research in my office. We have a lot of research students that come in, kids who are trying to get into med school or get into a residency, so they do research to help with that process. And the results are absolutely amazing, and my book does have some of these studies in it. My website, www.jointrehab.com, also has a page of the studies, and I think it's miraculous stuff. I think it's amazing to push the envelope of medicine in orthopedics and get past the surgeries. You know, to be honest, I have new patients come in almost every single day who have had failed surgeries. That's not fun. You know, the surgeries are not fun, and then to come out worse is certainly not fun. So why not do it the easy way, the simple way? Give me a call right now. You can talk to me live, and you can ask questions about your friends, your family, or yourself, and what hurts, and how it's possible to heal it up. So the phone number to reach us live right now is 866-870-5752. If you want to call the office and get other information, the phone number there is 800-300-9300. If you'd like to watch me do videos of these procedures all over the body, I do everything on the body. I'm not limited to knees, hips, shoulders. I do toes and bottom of the feet and Achilles and thumbs, and there's arthritis all over the place, necks, backs, you name it. The videos you can see on the website at www.jointrehab.com. Okay, Nita?
Sounds good. How about telling people what else is going on in the office?
Excellent. So I do this on the musculoskeletal system for pain, but it can also be done on the face to regrow the collagen, and that's called the vampire facelift because we take your blood and then it's filtered and injected into the face. The face is numbed up so it doesn't really bother you very much. And then it can also be done on the top of the head for those people who are losing their hair. If your hair is thinning, there are studies on PRP and stem cells that show that hair follicles can be regenerated and hair can be thickened up. All right.
Wow,
so
that's amazing.
Here's a question that just came in. I'm interested in stem cell injections. I was diagnosed with a labrum tear in my right hip. So what is the labrum? The labrum is a Latin word meaning lip, and the hip bone is the femur, which is the thigh bone that comes up and articulates with the pelvis, what's called the acetabulum, which is like the cup that it fits into. And the labrum is a fibrocartilage sleeve around the around the femur bone. The humerus bone is the arm bone. But we have the same thing in the shoulder. There's a labrum in the shoulder too. And we can inject that and heal that up very often. So I see a lot of people that have labral tears that don't have pain. And how do I see those? Because there's studies done on it. Don't be duped into getting a surgery on a labral tear in your shoulder, your hip, or somewhere else. Because if you Google labral tear surgeries, you're going to see the results are not great anyway. That's a setup for a failed surgery. So I think the best way to help it, from my experience in 25 years, is to do this with regenerative medicine. I can watch with my ultrasound, and that needle goes right onto that labral tear. I can see it live. And we can watch the solution cover the labrum and go into the joint itself. So it's a pretty magical thing for me to do. I love doing it, and I'm very lucky that I get to do this all day, every day. My wife always says, "Come on, let's go for a vacation." I go, "You can go. I'm on vacation at the office." I'm serious. I love what I do. Every one of my patients gets my cell phone number and my personal email address because I like the connection with my patients. I was born for this, as they say.
Yes, you were.
So I'm going to go to another question that's on a hip. This is an interesting
You want to
one.
give the phone number again?
I'll let you do that.
866-870-5752. Right here in the studio. Give us a call. You get a free call with Dr. Darrow. And a free book, by the way, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Totally free. Give us a call.
So, Nita, can you hear me now? I hit the cough button. I don't remember if it's up or down.
I hear you now, but I did not hear you cough.
So down means it's you can hear me, and up means go ahead and cough. Have you got one of those on yours?
Mine's just in and out button.
Okay, good,
Yeah.
good. So this is a real interesting issue. This person says they have necrosis and foot pad atrophy. Uh-oh. Let's see what they say. I've suffered since 2014 with foot pain, a neuroma first, many surgeries and cortisone shots later. The orthopedic surgeon said I have necrosis, that means death of the tissue, and foot pad atrophy. Well, that's from steroids, people. Cortisone, that does that to tissue. It kills it. Reading your info has been very interesting. Our orthopedic said nothing will help me anymore. Well, your orthopedic surgeon doesn't know much about regenerative medicine, I think. So I've had people that have had a lot of different areas of the body that have been damaged by steroid injections, tendons, ligaments, cartilage, you name it. And by doing platelets and or stem cells, we can actually grow some of that tissue back. So I haven't examined this person with the foot pad atrophy. I'd have to see it and touch it and see if it's something that I think will help. I had a woman many years ago in the dark ages of my career when a woman came in who could barely lift up her right wrist, her right hand, because she had 16 cortisone shots on her right elbow for tennis elbow.
That's it? She only had tennis elbow?
She had tennis elbow, but she
Wow.
had 16 cortisone shots over the years there. And what did it do?
Destroyed her bone.
It destroyed the tendon that connected to the bone. Maybe some of the bone, too. I did not have an ultrasound back in those days. We didn't use ultrasound to guide needles, so I don't really know exactly what was going on. But I had to inject that many times, and we got her back to playing tennis again. But my goodness, why go through all of that when all you need to do is get regenerative medicine with platelets or stem cells right away when you have the problem? I wouldn't use steroids. I mean, once in a while you've got to do it. If someone comes in and they're bent over sideways or they can't get up and they've got a terrible sprain in their low back, I might use a very low dose of a steroid with lidocaine, and in 1 minute they get up. I just had one of those the other day. It was a man who was 93 years old, and he could not move. His daughter and her husband brought him in, and he couldn't even lay on his tummy. I had to inject him on his side. And excruciating pain. He was yelping as he moved around. I injected him, and literally in 1 minute he had a smile on his face. And
That's awesome.
I said, how do you feel? He goes, I can't believe this. I feel great. So there is a place for it, but that's not a healing technique. That's a technique to get people out of miserable pain. And I said, you come back in a week and we will start your regenerative medicine and help regrow those ligaments in your low back where you're having that pain. So if you want to look it up, folks, you can look on Google iliolumbar ligament and intraspinous, supraspinous ligaments. That's what I injected. And it's a very simple thing. It's a sprain of the back. And unfortunately, many people who have pathology on images that's not causing the problem will end up getting a surgery for something that the surgery doesn't fix, because it's only an enthesopathy. Nita's second favorite word.
That's right.
Her favorite word is serpiginous.
Oh, we have not discussed this yet. Spelling, please. Serpiginous. Oh, I can't wait to hear this. Serpiginous. You know, I love language. And
I know. And medicine is, medicine, we learn in medical school 12,000 new words every year, if you can believe that. That's
Wow.
what they tell us. So it is learning a language, and I love that. I love that. I love that. I love that. I studied 4 years of Latin in high school, and a lot of medicine, the terms are from Latin and Greek. So I love piecing the words together. It's a lot of fun.
well, it actually refers to a lesion or ulcerated region having a wavy margin on the skin.
Yeah, the wavy margin refers to snake-like. Have you ever seen a snake trail?
Well, on TV, but I don't go in the mountains like
okay, like I do.
Right.
I'm going to be hiking in the mountains today after
That's
the show.
funny.
Yeah, serpiginous. I lived in the Indiana sand dunes growing up. I lived in Chicago, but we spent 4 or 5 months a year in the sand dunes, and you would see the snake tracks all over the place. They weren't dangerous snakes. They were just, I don't even know what type, king snakes, garter snakes, things like that. But we'd see the tracks all over. We knew the snake was nearby, and we'd run away. we didn't like snakes.
That was probably really smart.
So, this is another thing. People come in, they go, I've got a neuroma in my foot. And it's not a neuroma. I examine it. It's definitely not a neuroma. It's just what we call a metatarsalgia. The metatarsal bones are the bones in the bottom of the foot. There are metacarpal bones in the hands, but it's anomalous, same thing. And I usually heal those up using platelets or stem cells. So people don't need to do surgeries or get cortisone shots for that in most cases. I have yet in 25 years to see a neuroma, something called a neuroma, that I couldn't help by using regenerative medicine of platelets and stem cells. Certainly, I think surgery is a way overkill, and I get way too many people who come in post-surgical with worse symptoms and post-cortisone with worse symptoms, and we get them healed up. So, let's see. Here's another question. It's a torn labrum in the shoulder. We actually covered labrum already.
How about knees? We didn't have a knee problem yet today.
We did have someone talk about knees a little bit, one of the callers. But
that was Mark with a K.
With a K. I'm a Mark with a C. Okay, here's a good one. Yeah, Nita, I've got this one. Got you covered, Nita.
All right.
All right, so the question is, knee pain, old meniscal surgery. Patient says, or the inquirer says, I had prior arthroscopic meniscus surgery. By the way, arthroscopic, what does that mean? Arth means joint and scopic means camera. So it means that small tools were used with a small camera inserted into the knee joint, And people think that's cool. They think that's fine. I just had arthroscopic surgery. Well, it's no different than an open surgery, really. Open meaning you use a scalpel to cut the tissue open. It can be safer because there's less trauma done, but the damage can be just as much. And you can take tissue out and destabilize the joint with arthroscopic surgery just as well as with an open procedure. So a person says, I had prior arthroscopic meniscus surgery. I won't say which clinic. It's a very famous clinic in LA. About 32 years ago. I'm now 65. Pain has worsened. Please advise. I've listened to you on AM radio for a while. It's the same old thing. I mean, I talk about this on every show. Don't do a surgery. Why take tissue out? All you need to do is regenerate and rejuvenate the area using platelets or stem cells. And that's what I would tell this gentleman to do, who had the surgery, which maybe lasted for a long time. But the problem is, once you have a surgery, you're going to destabilize the area because tissue is removed generally. Even if a surgeon says, I'm just going to sew up that meniscus, what I find is when they go in, they cut out what they consider to be excess or loose tissue, which I think is good tissue because it continues to cushion the bones from each other. I don't like these surgeries. I don't like the meniscal surgeries. There's study after study showing that they don't work. Why they continue to be done, I do not know. It's the medical industrial complex. I don't want to get into that, but I'm just putting it out there. It's a money machine. And look, I love the surgeons. I'm not saying they're bad guys. They're great guys. It's not easy to do this stuff. But my wish is that these type of surgeries are not done and that the surgeries are left for things that are terrible. Sure, get a surgery if your knee is crushed. But for arthritis, no. For meniscal tears, no. For labral tears in the hips and shoulders, no. I get people all the time coming in going, I've got to get a joint replacement. I've been to 3 surgeons and they told me. And we heal them up using platelets and stem cells. Back surgeries, crazy results coming out of that. We have people that have died from some of these surgeries. I'm just not a fan. I'm not a fan. I apologize for not being a fan of the tradition and the culture of medicine, but I just am not. I found other things. I like natural things, and I like to get people off of medication if we can, and that's a big thing of mine. Can't always do it. Sometimes you have hypertension and you're in good shape. You may need to be on hypertensive medicines. But a lot of people may have hypertension medicine because they're obese, morbidly obese. Your blood pressure is going to go up if you're carrying an extra 100 pounds around. Just think about it. And if you have arthritis in your knees and you're 100 pounds overweight, you bet that caused your arthritis. The body can't take this excess weight that people have. What I do with my patients is I offer them for free, whether they treat with me or not, to text me every morning with their weight. And I just got a text a little while ago from a gentleman who is about 250 now. He's down from about 275. And he's now watching his foods and learning what it is that's causing the increase in weight, which is typically carbohydrates or massive amounts of food. And I text him back in 2 seconds. So there are days when I'm going to get like 10 or 15 patients just texting me all at once. I love the communication with my patients, and I love getting them healthy. So even though I do musculoskeletal pain, I'm still interested in people's health. I did a fellowship after my residency at UCLA on what is called natural or alternative medicine. There's a lot of names for it. So I know a lot of different ways to help heal the body that are sort of outside the box. And a lot of times I'll tell people to just continue what they're doing with their traditional doctor because that's the best thing for them. It's just everybody needs something different. And I'm always looking for more ways to help people heal. So I'm going to give out the phone number. I hope you call me right now, make the end of the show a little interesting. And if you want to talk to Nita or I right now, the phone number to the studio is 866-870-5752. If you call in, I'm going to send you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a couple hundred pages long. There are 264 studies, scientific studies, on how regenerative medicine can help you heal your body and how surgery can actually hurt the body. Listen, I'm not putting down surgeons. I'm not putting down all surgeries. I'm just seeing that most of the surgeries that come to me, people that have had surgeries, have failed. So be careful about that. Let me go to, here's another interesting one. A sesamoid fracture. Nita, do you know what a sesamoid bone is?
I do not. But I'm alerting you also that we're getting a call in a minute, just letting you know. But what does that mean?
A sesamoid bone. Why don't you look it up? You're good at looking stuff up.
Okay.
And I'll talk about what it is.
Okay, and let's talk to Richard.
Okay, we'll go to Richard. Richard, you've got issues with your L3-4, your lumbar vertebrae. What's going on?
Well, it's not me so much, but it's a family member.
Okay.
I'm just curious, based on your experience, somebody that's in their late 50s, early 60s that hasn't had surgery but has chronic back pain, image studies show some prolapse, symptomatic pain on and off. You probably had pretty good outcomes with that?
You know, it all depends. I've got to examine the person first and see where the pain is coming from.
Okay.
But, you know, typically when people say that, I have pretty good outcomes with it. It's pretty rare that I tell people I can't help them in one way or another. But I do have to examine this person. Do they have any radiation of the pain from their back down their legs?
You know, it fluctuates. It just depends on their activity level.
Okay. Most likely I can help them. Yeah.
Okay.
And again, I don't really care what the MRI shows, because there are studies showing people having, who have no pain. We do studies on people that have no pain and then image it, and we'll find these huge herniated discs, and they don't know about it. Or we'll find meniscal tears, we'll find labral tears. We'll find all kinds of stuff, but they're not experiencing any pain. So we know that we can't trust the image. I like to get the images because it can give me adjunctive information. And it also can tell me if a person is having some kind of a lesion or a cancer that's causing the problem, which can be dangerous. So I always get images, but most of the time I can't rely on them, and it's got to be my hands that I rely on. Is this your body you're talking about? Are you the family member, Richard?
No. Oh, no, it's not me. So I'm kind of curious, too. I'm sure it varies, but maybe there's an average. I mean, do you do one, several treatments, or it's just dependent on the pain or recovery? I'm not quite sure how that would depend on the patient.
That's the question everybody asks, and it's the question I ask myself all the time, too. It all depends. And I've seen people with very mild issues who have taken several treatments to heal, and people with terrible things that have healed with one treatment. And part of the issue is a lot of healing has to do with the person's subjective impression of their pain. So I've had some people come back after 2 weeks and say they're 20% better. And I say, okay, let's inject it again. We're on the roll, so we can get you 100%. And they go, no, 20%'s all I needed. I feel great. And then I had a woman come in with terrible hip arthritis, and we did one stem cell injection. She came back, and she said she was 97% better. And I said, great. It's been nice knowing you. Go have a good life. And she said, no, I want another injection. She said, I want 100%. So that's not up to me. That's up to the patient. Do you understand what I mean? It's their perception. Yeah.
Yeah. I mean, it depends on what their activity level is, what they intend on doing, and hopefully they won't be a repeat customer, that they get what they want, right?
Yeah. I mean, it's a lot of it's up to the patient. The number one failure of regenerative medicine of platelets and stem cells is overactivity. There's a lot of people that come in who are miserable with pain from sports. and they won't get the injections because they don't want to stop their sport. Anyway, Richard, God bless you, man. Thank you so much for calling in. Go to the website, www.jointrehab.com, to watch videos, and call my office at 800-300-9300. Thank you, Nita Valens, Suzette, Alex, and the rest of the crew. God bless you all. Thank you.
We'll see you next time. Thanks for listening.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870, The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.